4 weeks, they did it in 2 weeks. So when the Americans went to Japan, a place called Shoal, to be sure that, they said, is that how soon? They're looking for a name for the vehicle. The Americans said, oh, you're already done in 2 weeks, that soon. The Japanese said, okay, that shall be the name of the car, that soon. No matter what's happening that target, it's possible you can't get that back with the story. It's a miracle to have a pastor give a short prayer. That's 600 people. Just big. Please put your hands together again for him. It was really, really quick. Thank you very much. We love to just make a rundown, not introductions as it were, but for the purpose of some of us who are attending this kind of meetings for the first time, we just love that everyone who is here will just do an introduction. I'll start with the head table. Not that we do not know them, but let's just have them say those introductions themselves. I'll start with you, Ma, and then we'll run down the hall real quick. Thank you.
Good afternoon, young family. I'm so happy to be here. My name is Pharmapreneurial Pathway, State Coordinator of PSN YPG Aqua State. Thank you.
Good afternoon, colleagues.
Good afternoon.
Good afternoon, young pharmacists. My name is Pharmacy and Sunday. Thank you very much for having me.
I was just thinking to mention the 500K she won. That's the thing we do when money is involved.
Okay. Good afternoon, everyone. Good afternoon, colleagues. Good afternoon. My name is Amo. Thank you.
Good afternoon. Okay, I'm Jack Adela. Thank you.
All right, nice to have you all. My name is Josh.
Good afternoon, everyone. My name is Wanda Joseph.
Good afternoon, men and women. My name is Peter Grace.
My name is AKWA.
Okay, so I'm not sure whether I should add that. I'm not really the that again. The Vietnamese also say something.
Good afternoon, all. My name is Thomas Marvin Records, PRO, PSN, YPG, and I'm glad to be here.
All right, thank you very much. It's such an honor to be the MC for this event. I can tell you, fantastic, and I'm so glad to meet all of my senior colleagues who are here. Why not? We just have two of us who are the freshest units in Bryonic pharmacists who just got out of the shed a few days ago. Myself and my friend. Thank you very much for having all of us. So really quick, we can have the pharmacy anthem right about now. We can have that? Okay. Okay, so maybe Magdalene, who knows a lot of anthems, will just lead us to sing. Okay, thank you.
Okay, please, let's all rise for the pharmacy anthem. So the chorus we already know is, we are here. Whatever I say, we are here. That's it. We're pharmacists, we're proud of pharmacy. We glorious of the glorious PSN, pharmaceutical society of Nigeria. As men of honor, we join hands for pharmacy. Pharmacy, we are here. We are here. Politics, we are here. We are here. Community, we are here. Hospital, we are. Industry, we are here. We are here. Thank you very much.
Thank you. Thank you very much indeed. I'd love to just invite right about now that we have the coordinator.
People who is here with us, distinguished colleagues. Actually, there is a protocol we were to establish, but we're still expecting the dignitary because we have like 2 set events today, and they'll be with us shortly. So I'll just go straight to the address. I'm delighted to welcome you all to the YPG Week 2023. It's our second edition of the program like this. We started last year, and it's been a unique week. We had a lot of activities for this week. It was scheduled to feature entrepreneurial training, induction of new members, which of course we were there to welcome them, and our outreach was yesterday. Today is Symposium, and tomorrow will be our Thanksgiving service. So I welcome you all to the Symposium today. We are also grateful to our distinguished speakers who made it here on time. They created time out of their busy schedule to be here with us to impact on us. I would just like to give a brief summary. Of course, the speakers will do justice to the topic, but I would just like to tell us what we are here for. The term pharmapreneurship describes a pharmacy entrepreneur, one that various strategies and skills across practice, sciences, health outcomes, research, and pharmaceutical sciences, including innovating new products, services, or processes, and exploring new avenues. Pharmapreneurs strive to enhance the practice of pharmacy through their unique skill sets. They perform a unique role of bringing fresh ideas and innovative approaches to solve problems. It goes without saying that entrepreneurship contributes to economic growth and issues, and enhance pharmacists' professional development by providing opportunities to learn new skills and expand their knowledge base. These and many more is mostly needed in our present economy. The topic and speakers have been carefully selected to offer you the best as you all journey to a brighter future career path, most especially in the course of your professional practice. To our upcoming colleagues, talking about the students, I'd like to encourage them, they are still on their way, to encourage them to be steadfast in working hard in their pursuit of academic success. They are students today, but they will be pharmacists tomorrow, and we shall join hands together as men of honor. It is my earnest prayer that God Almighty will establish us all in His ways. PSN YPG is an interest group of the pharmaceutical sector of Nigeria, of which our primary goal is to safeguard the interest and as well protect the welfare of all the young pharmacists in practice. It's made up of pharmacists who are not more than 35 years of age and or not more than 5 years post-graduation practicing in AKWA IBOM state, including those that have been supporting our programs consistently. One of the primary goals of PSN YPG is to engage young pharmacists in capacity building, training, and personal development that will enable them to function effectively in the course of their practice. Hence, we organize this symposium. It actually started that we try to organize programs, and we have a very few number of persons turn up, but we are hopeful that they will join us as we progress. On this note, the leadership of PSN YPG and AKWA IBOM state shall consistently and relentlessly represent the views and interests of all young pharmacists in AKWA IBOM, especially as it concerns their welfare. Nevertheless, we must admit that some young pharmacists, in the course of their practice, exhibit unethical practice ranging from engaging in register and go to acting at the level of board directors as pharmacy owners, thereby according non-pharmacists the privilege to operate in retail pharmacy outlet, which goes contrary to pharmacy laws. We would have loved to have a full house, so we have to explain to them the reason why they will not have to go against pharmacy law, because we are actually fighting ourselves, and it's going to affect us in the nearest future. So I encourage young pharmacists to desist from such unhealthy practices. Together we can build the pharmacy profession of our dreams. Finally, and most importantly, I return all glory to God Almighty for sparing our life in this precarious time and granting us a wonderful opportunity to be here. So I'd just like to encourage you to fasten your seatbelts, and while you listen and learn from the various speakers that we have here, we assure you that all participants shall have a certificate of participation from this symposium, and of course, a very delicious meal. Thank you for being here. Long live PSN YPG AKWA IBOM State. Thank you.
Thank you. Thank you very much, Coordinator
PSN YPG.
PSN YPG. Thank you very much. I don't know that I'm still getting used to the terms. That's fine. That's okay. The last time she did something like this, which was during the pharmacy week, I think some weeks ago, I took a lot of time to recover from the chunk of chicken. So when she said food, I think that raised the mark in my head. I will never forget it. So I'd love to just at this point, for the first presentation for this afternoon, to do a presentation on basic life support training. A very fantastic one. A pharmacist, Chidwiken Charles. Please put your hands together for him. Thank you very much. Thank you very much indeed. Basic life support training. Thank you.
Okay, please, I want to stand on the system protocol. It's quite unfortunate that people that ought to actually benefit from this training, most of them are not here present, but I believe as we go on, they will be joining us. So, there's a couple I know somewhere several years ago. It's actually a story. The couple in question, they have just a child, a boy for that matter. So they are very well to do. Of course, they have all the basic things life can offer. So they actually had the plan of giving the child a very befitting life when it's about, both the child's education and every other thing life can offer. So, but it was quite unfortunate that something happened. One of those days, the child was, the son in question was actually driving somewhere and had a crash, an auto crash, and there was a whole lot of bleeding. So people were just crying and, but to cut the story short, the child passed on. You could imagine the type of heartbreak the parents would have encountered. But why am I bringing out this story? At the point of the incident, people were there. Probably professionals could have also been there. But what happened is that nobody actually did something immediately. They thought that the guy had died already because they just saw gushing of blood and other things. So why am I saying this thing? There's something more painful than death, and that is a death that could be prevented. So that's why we'll be looking at some of the things as a professional, as a pharmacist. There are things that you have to arm yourself with. You can also agree with me that due to the technology and how fast things are going now in the world, it also comes with so much eventualities, which include accidents and all kind of eventualities that somebody might not have planned for it. So that is where you come into the picture. The fastness of things now in the world. So I would indulge you to listen to me, and at the end of the day, if you have questions, you can ask, and I also will be asking you questions. Then, that is talking about first aid. First aid is not taught in school. At least that I know as a pharmacist. So the other day there's about, was it few months ago, we gave this training at the first international conference of the clinical pharmacists. So, and it was fantastic. In fact, it was idea of the moment that people were looking forward to getting. That's having the knowledge. The point is that when you are at a place and something happens, do you know what to do? Do you know what to do? At least to buy the person time Do you know what to do? You know, outside, if they pick you as a pharmacist away from the drugstore and put you in a place where there are no medication, which happen to be one core of our arms in practice, can you do something? Then first aid as a topic is very wide, but I'll just be narrowing it to some core parts which I know will actually help us very well. First thing first, you ought to have objective. When you want to be a first aider, you have to have objective. There are 3 core objectives that you shouldn't miss any of them. One is that everything you should be doing is to what? To preserve life. That's the one. There are actually 3 P's. I call them the 3 P's. To preserve life. To preserve life. Then, another core objective is to prevent further injury. You know, we are talking about casualties. Casualty, it can be different forms, which of course we'll get to that point, is to prevent further injury. So your presence in that stage should not cause more injury than what has happened already. Then the last P, which is also very important, is to promote recovery. To promote recovery. Remember, I said the first was what? To preserve life, to prevent further injury, and to promote recovery. So all the intervention that you are going to do will be centered. You should have this at the front of your mind, in fact, because when they say people should have something at the back of their mind, I don't usually understand that. So you should put it at the front of your mind so that you don't forget it. Now, that is the 3 P's. Okay, then let's take for an instance now. Let's assume that there is a collapse, which I know during your practice you must witness one. That's a collapse. There's a collapse, maybe just, it could be that you were there when it happened, or probably you just came in and saw the person lying down on the floor. 2 things. If you were there when the incident took place, of course, or probably you are not there when it happened. The point is that you have to do something. It takes about how many minutes to have a biological death? Is there anybody that can help us with that? Before the brain, before there's a biological death, how many minutes can the brain survive? Okay, we'll come to that. So now, you know, at that point, time is very important. The clock is ticking. We are talking about human being. If you've not lost a loved one, or you've not seen someone pass, you know that there are people that are so used to some kind of thing, they don't have feelings, but don't get to that place. If you get to that place as a professional, as a pharmacist, that means pharmacy profession to you is just a business, and it shouldn't be that case. So time is of very big importance. So what do you do first is to check for response. Of course, you might have witnessed presentation on CPR and all that, of course, but there's something you are going to learn on this one. So let's use this acronym, Doctors ABC, DRX ABC. So first thing you do is, starting with the D, is to clear the scene, because you shouldn't end up being another casualty. Are we together? you should not end up being another casualty, because at that point you are the most important person. So you check for danger. Is the environment safe for me? Is it safe for the person? It could be along a busy road or something. So you shouldn't just run into the scene. It could be a fire outbreak. You shouldn't just run into the scene. You have to first of all check the environment. You check for danger. If the environment is not safe for you, you make it safe the best that you can. At least you take precaution. If the casualty, if you need to move the casualty away, a bit away from the scene, you do that. So that is D. Then R is you check for response. You check for response. How do you check for response? Of course, you tap the person. If you know the person's name, you call the person's name. Then you tap and call. Then if there's no response, that means there's actually a case. But if there's a response, of course, you don't have to go further than put the person in recovery position, which if you have a solid suppress will demonstrate it. Then, but when there's no response, that takes us to X. You shout for help. You don't have to leave the person and start running away.
That's nothing.
You know, so that's why I said time is very important. Time is very important. And let me tell you, one thing I've observed as a facilitator is that in the real life scenario, your mind is very hard for your mind to be coordinated. But that's why you need this acronym. So it's very hard for you to be coordinated. In fact, some people will just be shouting Jesus at that point. You know, they will even remember, they'll forget all the training. You know, so now you shout for help. If there's another person, you send the person to go and get help. In abroad, of course, they call 911, but here you go and look for KK or look for mobility, something that can transport the person. But even before that time, so then another one is A, which is airways. Airways is very, very important because that lady needs oxygen. So you check for airways. You clear the airways. How do you clear the airways? You clear the airways by, tilting the jaw up. You place one hand on the head, put the other one on the jaw, and raise it up. Why do you put it on that position? It will enhance air passage. Air passage, because if the individual is like this, it's very hard to breathe. So you have to kind of straighten the head, thrust it up. So, but you don't have to over thrust it, especially in children. You don't have to over thrust it, but if it's an adult, of course you can thrust it up. Then that takes us to B, which is breathing. You check for breathing. You can put your ear towards the person's nostril and find out whether the air the person is bringing out is touching you. As you're checking, you're also looking at the rise and fall of the chest. So when those things are absent, that takes us to see that is compression. Most of us will just hear compression. Oh, I know compression. But the point is, you know how to do compression. Because effective, I've seen CPR work. I'm telling you. I've seen it work. It's not like save life. So now, before you start compressing somebody that's talking, you don't have to start pumping the person's chest. It's not necessary. Or somebody that is responding well or probably breathing well, but just out of shock, is not really coordinated, you don't have to start pumping the person's chest. So there's actually a technique. Just let me keep the mic briefly. I believe all can hear me. So this is your farm. This is your palm. Then you click another one. Where are you going to use the hinge? The hinge of your palm. The hinge of your palm. You have to stay very close in a way that it will be convenient. Close to the casualty. Then, what is the depth? Of course, the depth depends on a child, how weighty the person is, but it shouldn't be more than 5 cm depth they are going to compress. So now, when you are compressing, I've seen people demonstrate this thing when we have a very elaborate training and they do it wrongly, and people that supposedly have certification on first aid. When you are compressing, there's something very important that you have to do for it to be effective. You see this hand, you are kneeling very close to the patient. Where should the strength come from? It's from your shoulders, not from the arm. Your arm don't have to be, buckling up and stretching. No, your arm have to be straight. You're compressing. You're compressing. You just give, according to UK specification, you give 30 chest compression. Why are you compressing the chest? You are trying to shock the heart muscles. At that point, the individual is dead, but you are trying to shock it up. This thing alone can save somebody far away in that village that you might travel during the Christmas. This knowledge alone can save somebody, I'm telling you. So as you're compressing, I normally advise people to count it out. You go 1, 2, you count. Why are you counting out? It will help you to know, 1, the number of compression, and also it will help you to be coordinated. When you're giving your 30 compression, you give 2 rescue breaths. 2 rescue breaths. And that's why as a first aider, you have to be prepared. But let's face the reality, so many at times, one might not be prepared. But as individually as a first aider, in the gym, I have my first aid kit. And another thing I will have to also remind us are the kits. The kits. You don't go to farm empty-handed. And the first, what is in your first aid box or your first aid bag or whatever, is peculiar to the environment in which you operate consistently. If you're, let's take for instance, I am always at the gym now. My kits are different. There are some things there are some peculiar things you might see on my first aid board that ordinarily you might not see it on regular basis, because these are things I know that will help my clients should something like that happen. You give your 2 rescue breaths. At that point, it's not the issue of, oh, how will I put my mouth on the person's mouth and all that, or if what of if I contact this and that. Of course, there's an improvised mouth, a kind of mouth casing that you can place on the person's mouth and blow the air. How do you blow the air? You just blow 1, you blow again, 2, then you've given 30 and 2 rescue breaths. At that point, you now check has the guy started or has the person started breathing. If the person has not started breathing, you get again 30, 2, 30, that the chances are that the person supposed to come around, depending on the time the incident happened, and depending on the cause of the incident. And it might also interest you to know that, of course, it's not every intervention that will come out positive. So if you're a first aider, don't be discouraged. But at least, did someone do something? Yes. Somebody did something. So that's it. And then that also takes me to what are you supposed to have as a first aider? What are you supposed to have as a first aider? Several things. One of them is very important is bandage. Your bandage. If you don't have any other thing, bandage is very important. Bandage is important. Have your bandage peculiar to where you find yourself most of the time. Like me, I have an inhaler inside my box. You know, I have glucose inside my box. Why do I have all those things? Perhaps if somebody is a diabetic person, and I didn't know, and I was pushing the person, exercising, and all of a sudden hypoglycemia set in, and the person collapsed. Then I have a glucometer for checking blood sugar level. Of course, I have my blood pressure machine intact. So you just tailor it according to what you need. If you drive, those things supposed to be inside the trunk of your car. Inside the trunk of your car. Remember, pharmacy is a calling. It's a calling. Is a calling. So you have to make yourself ensure that you are agent of lifesaver. Okay, now back to our casualty. You're giving 30 to 32, and eventually you notice there's a rise and fall of chest. That means the person has started breathing. You put the person in recovery position. So I'm just going to demonstrate it. Sorry, we don't have a study software. Just assume that the person is lying down like this. You drag this hand, put it, drag it to the person's side. You see it? You drag this hand to the person's side. Then, while you remove this arm apart, just assume that the person is lying down like this. Then, you drag the leg, put this leg across to be as if the person is now lying down like this. That's your recovery position. That position works wonders, because at that position, that's the most comfortable position for circulation and for breathing. So at that point, you look for at that point head also arrive. Then before we move on, are we following at all?
Yes.
Okay, so then let's talk about epilepsy. That one too, I've seen it. You are just in a place, someone started, shaking violently. And you know that thing is epileptic attack. What are you supposed to do? If you want to dispense drug and all of a sudden the person fall off and hits, and that is epileptic. And people, that people will just start on it.
Yes.
So, what are you supposed to do? For case of epilepsy, what you do is this. At that point, clear the surroundings for the person. Why? At that point, control of his muscular movement. So you clear the surroundings so that the person will not be injured. Then, but there's very important thing not to do. Don't interfere with the episode. Don't go holding the person. Oh no. Just allow the episode to go on. But clear the surrounding to minimize injury. If the person is on the floor already, what you notice most of the time, they will be hitting their head like this. So if there's something, if there is a soft pillow or anything around, just put it on the person's head. Don't use it on your hand because the person will knock his head on your hand and there could be injury. So just put it and then clear the surrounding and time the episode. Why are you timing it? Is to give vital information for further assistance. So now, when the episode has gone down, you now check your ABC again. Is the person, can the person hear you? You know, if they are not breathing, you do your CPR. But if the person is breathing, you put the person on recovery position. That's on epileptic attack. Then let's go over to the bleeding. Bleeding happens to be one of the, if not ranking the first cause of death during auto crashes. When you notice bleeding, what are you supposed to do as a first aider? How do you do it, and what type of assistance can you render? Very important. Of course, when you approach a scene and you see somebody lying down and there are blood everywhere, first thing you have to do is to check where the blood is coming out from. If there are injuries, and that's what we call primary survey, you know, you check the person from head to toe. Primary and secondary survey, you check the person from head to toe. Know, is there a fracture here? Is there an open wound here? Is there bone fracture or breakage? Where is the blood coming now from? If there is injury in the neck and there's another one close to the neck, of course, you should attend to the one closer to the neck, because that's the one on that place to apply pressure. But if it is a serious injury that is very big, you do what we call wound packing. Wound packing. See, at that point, using a sterile thing is important, but that is not the overall guideline. At that point, you have to save the person. You know, if whether the material you are using is sterile or not, at least let it be clean. You open the wound and pack. Assuming if it's a towel, or maybe you have a bandage, this is a gauze bandage, you know, you just open the wound and then stuff it inside. As you're stuffing, depending on the depth of the wound, you know, stuff it inside, and that's why you need your glove. You are stuffing inside, and assuming if you put all and there's still space, put again. Then at the end of the day, you wrap, fold another one and place on top of it. Either hold it or use something and support it. You know. Then another way to go about bleeding, if it's on the arm or leg and it's a serious one, you can put a tourniquet. You can tie a tourniquet just slightly above the wound. Of course, you can't tie a tourniquet on the abdominal area. I'm talking about hands or leg. You tie it just above. Why are you tying a tourniquet? Is to delay. It's actually to decrease the level or the speed at which the blood is gushing out. So you tie a tourniquet. But if the wound is just a minor one, of course you tell the person to apply pressure and you run water on it, and then probably there's antibacterial cream they want to apply on it. You apply it and use a sterile dressing on it. All right, let's talk about choking. You are in a restaurant, you are just eating with someone, and all of a sudden somebody started choking. I didn't mean from someone choking. Some other person was just choking, and you thought it's a very easy thing, and all of a sudden the person is turning blue before your very eye. I could remember when we did the internship at UUTH, madam, your hand there. You place your hand there. You know, you don't stay directly at the back of the person, because if you do it, the person's head might hit your mouth, and you now have a bleeding mouth. You know, if you stay one leg in between the person, and you are by the side, you know, and you are by the side of the person, you know, this one is here, you know. So you just, I'm not going to do it to him because he's not choking. So, but the movement is two movements, you do it at once. Inside and forward, inside and upward. You know, you do it upward, you know, you do it, apply pressure. You have to be firm. This hand have to be firm, you know. So it's, there's been numerous instances that movement alone ought to push air through the respiratory tract, and whatever that is blocking the tract will just fall off. You know, you just trust it. You know, if you do it once, it didn't happen, you trust again. You know, that's one. Then another thing you do is back slap. Back slap. You know, you get the person to bend down a bit. You know, you get the person to bend down a bit. You use the hinge of your hand, and you just hit, and you hit. So there's also a probability, thank you so much, that whatever is choking the person will have to come up. All right, there's a hand up.
This talk, I'm just the maneuver.
Yeah.
Can one do it to a pregnant woman?
Okay.
A pregnant woman is choking. Can you compare something like that?
Okay. Well, no, you won't do it with a pregnant woman, and that's why there's another alternative. That is the back slap. If the person is pregnant, use the back slap. Use the back slap. So then, another thing we are going to look at is the issue of burn injury. You know, you witness a burn, and there at UUTH, Pharmapreneurial, you will remember when we had about 3 or 4 persons. Yes, that were admitted. I think 2 of them died. Yes, that was a serious burn. So when you witness a burn, what do? You know, the mistake you should never do is has shown that eyes will do more harm than what you intended to do. So what you do is that, first of all, if there's a clothing around that place, cut it off. Cut the clothing off. Expose the burn. Second thing you do is to pass a running water over the burn. Just a running water for a few minutes. Pass a running water over the burn. If it's not a serious burn, of course, once you run the water and then for some time the place the pen we actually come back. See, first aid is not like you are giving the comprehensive treatment there. No, you are preparing yourself, the individual, for further things. So you run the waters, and then if there is a sterile dressing, you use sterile dressing on it. Remember, I said don't use ice block. Very important. Okay, then before I close, let me talk about children. Because at times when we discuss about first aid, children use infants and new babies. People don't, at times they don't remember to put them into consideration. If it's a baby, assuming a baby is choking, a baby is choking, so what you do is that you get a seat and sit down. Bring the baby, use your hand and support the head. Support the head like you are holding the baby. This is the baby's neck. You support the baby. Then do as though you are tickling the baby's head down a bit, in somehow an inclined position. So you move just a little above the navel. Use 2 fingers if it is a newborn or maybe a very or an infant. You just put, that's that's actually the equivalent of the Heimlich maneuver. You just do it, shake it, put it like that. You don't have to go and start holding the baby like this. No, that's how to do their own Heimlich maneuver. And then another thing is that if it's a baby that you are giving CPR, if it's a child, let's say 2 years up, you can use one full hand. But if it's a baby less than 2 years, you can use 2 fingers. And when you are giving the breast, you don't. Another thing I forgot to mention is that in adults, remember, before you give the breast, you pinch the nose. You close the nose, open the mouth, put the breath. But in a child, you blow the breeze. Your mouth should cover both the nose and the mouth. You blow it in. So then, studies have shown that most times when an adult is having cardiac arrest, is actually due to most times it's actually due to heart issues. But whereas in children it's due to respiratory problem. So, and you handle them separately. If it is a child that having that arrest, a kind of hardness in breathing, so the approach to it is quite different than when it is an adult. So what's the approach to it? First of all, if at that point what they normally need is to put them on recovery position and they will come back, except if they have no breathing. Except if they have no breathing. But once there's a breathing, just put the person in recovery position. And also note that no matter the intervention you do, the climax of it all is to put the person on a recovery position. So I will conclude with this. Remember, we started with our 3 priorities. That is our 3 objectives, which is to preserve life, prevent injury, and then prevent further injury, and what?
Promote recovery.
Promote recovery. Then there's another thing, 3 C's you have to bear in mind. One is check, call, and care. Check, call, and care. Check, call, and care. In the fit of your intervention, have these 3 C's in mind at all times. Check, call, and care. What are you checking? You are checking the individual, you are checking the environment. What are you calling? You are calling for help. Care, what are you caring? Is all these things that we're discussing. So just have it in your mind. Check, call, care. Check, call, care. And then somebody might be asking, oh, this is Nigeria. What of if someone sue me and this and that? What of if I'm doing something and there's this thing now, the person now said, I'm the one that caused it. You're not alone. There's a law called the Good Samaritan law. It's actually on your side. In as much as you're acting under the guideline of first aid training. So if there's a legal action against you, of course, the person will not have his or her way. But there's also a little clause on that law. If it is a child and the parents are there, you have to get consent before you attend to that child. But if the parents are not available, you can go ahead and give your first aid intervention. Then if it's an adult that is that's involved and the person is conscious, you have to also get consent. But where the adult is not conscious, you just have to intervene. In fact, the law is even, there's a more law that is against somebody that did not act, especially in places like outside this country now. If there's an issue and there's an event of death and they notice that there's a professional that's there and you didn't do anything, they will sue you more than that. So at this point in time, I'll be calling for your questions and your reactions.
Thank you very much. So good to see you, Pharmacist Samuel. Very good to see you. Right about now, I would love to take the company presentation. That is MAKE. Not sure what the full name is, but that company is MAKE. Please put your hands together for Pharmacist Samuel. Thank you very much for that wonderful. Some of us are not clapping, most of us are not clapping. Thank you very much. Thank you. Thank you so very much.
Thank you.
Beta 1 cells, beta 2 cells, and beta 3 cells. So beta 1 cells, beta 1 receptors actually are located in the heart. 80% of beta 1 are in the heart, 20% are in the lungs, and there's another type of beta 1 also in the kidney. So due to adrenergic stimulation, external adrenergic stimulation, of course the flight response, so the person is jerked, and the heart rate begins to increase. So your heart rate, and in the kidney level, it's beta 1 stimulation that leads to renin release actually. And you know renin, angiotensin, through vasoconstriction. That's the pharmacology. Okay. So talking about the heart rate, this is just an overview. So multiple systems contribute to elevate cardiovascular risk, and these systems include the vascular contractility. Of course, if a patient's vein is stiff, blood pressure increases. So arterial resistance will come. Then sympathetic nervous system, that's what I talked about, sympathetic overdrive. Increased heart rate and cardiac output. Then the blood system is the RAS, renin, angiotensin, and aldosterone system. And that will result in plasma renin release and increased BP. If you have a medication that is able to tackle these three systems, if you have a medication that is able to tackle these three systems, you will have a reduction in heart rate and you will have a reduction in blood pressure. And anything that reduces heart rate has a capacity to reduce blood pressure, because blood pressure is cardiac output times peripheral resistance. Okay? If you take out the cardiac output equals heart rate times stroke volume. So anything that reduces the heart rate will invariably reduce blood pressure. Okay, so moving on. So 7 in 10 patients 10 hypertensive patients would actually need more than immunotherapy to control their hypertension. 7 out of 10 would actually need more than immunotherapy to control their hypertension. And to achieve BP control, often multiple therapies are required. An example of such therapy is a beta blocker and a calcium channel blocker. Okay, so factors influencing cardiovascular risk in patients with hypertension. The main thing I want to look at is heart rate resting values greater than 80 beats per minute. If we still remember pharmacy school, we were taught that normal heart rate is 60 to 100. So above 100, you don't have tachycardia and you have to check it. But currently, that's changed actually. It is now 80 beats per minute. Anything greater than 80 beats per minute is an indication of a beta blocker. And bisoprolol, Concord, happens to be one of the best beta blockers actually. Why? It's cardioselective. So there are two mediated side effects of the lungs. You bypass that. It has a balanced clearance also. So the clearance is 50-50. 50% renal and 50% hepatic. So if the patient has mild renal disease, you can still give bisoprolol. If he has mild hepatic disease, you can still give bisoprolol. Okay? So resting heart rate values greater than 80 beats per minute. What does that tell us as pharmacists? It tells us that while I'm checking the blood pressure of the patient, my eyes should also be on the heart rate. Once I see a heart rate that is greater than 80, I should run my mind to sympathetic overdrive for this patient. Okay, so moving on. Why are we concerned about heart rate greater than 80 beats per minute? The reason is that as heart rate rises, so does cardiovascular mortality. So if you check, the red bar is all-cause mortality. All-cause mortality involves things like stroke, things like heart failure, and the rest of them. So if you check, as the heart rate is increasing from 65 to 85, this all-cause mortality has increased, by the red bar has increased by over 50%. And that's a concern for patients actually. That's a very big concern for patients. This is why we have to be concerned about the heart rate of our patient. This is a study that was done to evaluate the impact of heart rate in patients with hypertension. Okay, so heart rate greater than equal to 79, that greater than 80, invariably, and BP control, a high heart rate and a controlled BP. Let's get it. A high heart rate and a controlled BP is worse than having a low heart rate and an uncontrolled BP. Do you get what I'm saying? No. Thank you for saying no. Okay. So I'm saying that a high heart rate, you have the patient. The patient's heart rate is 120, but his BP is 120/8. Do you get it? He has a higher heart rate but controlled BP. That condition is worse than a low heart rate and BP uncontrolled. Do you understand? Do you understand? Give me feedback. Do you understand? Is it clear? So the patient has high heart rate and the BP is controlled. Another one has low heart rate and the BP is not controlled. The guy with the low heart rate is better than the guy with the high heart rate and his BP is controlled. And it's not just words. It's actually facts. So this is how the study goes. High heart rate and BP control. The susceptibility of that patient to primary events are events that can lead to death, is about 14%. But look at the low heart rate and BP uncontrolled, it's about 10%. So the low heart rate and BP uncontrolled is better than high heart rate and BP control. That's what we're trying to say. So in managing our patient's blood pressure in any setting, hospital or whatever, you should check the heart rate of those patients. In fact, a high heart rate is an independent predictor of diastolic hypertension. What do you mean by diastolic hypertension? It means that systole, you know our blood pressure, systole and diastole. Of course, systole is contraction, right? Diastole is relaxation, right? So your BP checking is checking when the heart is contracting, the pressure in the veins when the heart is contracting, and the pressure when the heart is relaxing. That's that. So if the patient has high heart rate, the patient has diastolic hypertension. What are we saying by diastolic hypertension? The heart is not resting enough. If your heart doesn't rest enough, you're prone to cardiovascular disease, because you're prone to coronary artery disease, because if your heart is not resting enough, your heart is not getting enough oxygen. It's at rest that the heart actually gets its own supply of blood to get enough oxygen. So it's not getting enough oxygen, and that in the long run will lead to ischemia, will lead to myocardial infarction and others. Okay, let me know. So this is the European Society of Cardiology guideline for hypertension. It is recommended that beta blockers are combined with any of the other major drug classes when there are specific clinical situations: angina, post-myocardial infarction, heart failure, or heart rate control. As far as if the heart is concerned, if you want to have cardio protection, your best bet is a beta blocker. But we have to have a caveat here that heart rate greater than 80 beats per minute. If you have a patient with heart rate at 65, that patient doesn't need a beta blocker, especially if the patient has a healthy heart. As you move further, you would see it actually, because if you give a patient at 65 a beta blocker, you might be taking the patient to bradycardia. That you slow the heart rate. In fact, a doctor called me. He said he's an 84-year-old man. He bought the drug and took it. Now, the drug is for the patient profile of Concord AM is for middle-aged patients, 30 to 60 years. Those are the patients for Concord AM, 30 to 60 years. Why middle-aged? It's middle-aged because as age increases, the beta receptors get depleted. So it's actually very hard to find an elderly person with an increased heart rate. It's very hard. And it's middle-aged. Then the third